Hi, welcome to another episode of Conversations with Eminent Women. Here we'll speak to phenomenal women doing absolutely amazing things in their different spheres. Today we deal with your gut. Gut health is the conversation today, but we get to know our guest even a bit more better. That is Dr. Barbara Makumbi. My name is Tsegohajo Moagi. Dr. B, thank you so much for your time.
Thank you so much for having me.
So let's start with what inspired you to become a gastroenterologist.
Well, my dad's actually a gastroenterologist,
Okay.
so not very creative in choosing what I wanted to do. I tended to go to work with him a lot. I think being exposed to the medical professional through my parents actually got me interested in basically, I know it sounds cheesy, but helping people, you know.
Yes.
And the nice thing about being a gastroenterologist is that you get the best of both worlds when you're a surgeon versus a physician. You get to go to theater, do scopes, and I really like using my hands. I'm not good at sitting still, so that's basically it. Yeah.
So tell us then, what is it actually that you do? Now that you've spoken about theatre, I don't think we often think of gastroenterologists as people that actually go into theatre. What is it that you do?
So I'm actually a physician.
Okay.
Initially trained as a doctor in BCHB initially, then trained as a physician as a specialist, thereafter subspecialized in gastroenterology. So as a gastroenterologist, we actually do scopes. We do endoscopy, interventional and diagnostic like scopes, basically. We do consults. We are consulted to patients in ICU, in the general hospital, and we do outpatient procedures as well. We do outpatient consults for patients and deal with anything relating to the gut. So the gut being from the mouth to the anus, basically. From the mouth, any lesions in the mouth, overlapping with other specialities, as well as your esophagus, reflux, for example, your stomach, gastritis, any malignancies that we can diagnose too, your colon, as well as the pancreas, your liver as well. So it's a lot to summarize, but there's many, many things that we do and deal with.
I mean, it's quite interesting because I think we always think of gastroenterologists as just dealing with the gut health, and gut for us is the stomach.
Yeah.
Is that just one of the myths that, you find that you consistently have to debunk?
Yeah, a lot. So people don't realize it's a very, very, very long system, basically. Like they think the gut is literally just the stomach, the area of your abdomen. But like I said, the mouth to the anus. And the gut doesn't necessarily involve the liver, pancreas, etc. But that's what we look at as well.
What are some of the biggest misconceptions do you think that people have about gut health?
Misconceptions that, look, the gut's not that important. I'm biased though, The gut, I believe, is one of the brains of the body, and it's been shown scientifically recently. Your gut has many innervations, one of the main being the vagus nerve that connects directly to your brain. So it's the brain, one of the brains of the body, basically. It produces hormones, it produces all sorts of factors that actually can control your mood and other systems in the body, etc. So there's a lot of misconceptions, and there's a lot of online, not necessarily medical professionals that are also kind of perpetuating some of the misconceptions. And that's why I actually do a lot of these interviews, go on radio, speak to people so that we can debunk questions and understand the gut better, because it's so important. Yeah.
What are some of the things that could contribute to a poor gut?
So lifestyle in general, it's really, really important to have a balanced diet, exercise, not have too much alcohol, stop smoking, balancing all those things out are so important for your gut. That being said, the gut has a lining, right? And in your gut, you have millions of bacteria, good and bad bacteria. And the key to gut health is what we call the microbiome. So the microbiome are bugs in your stomach, basically, like I've mentioned, that need to be balanced, fed, nourished, and eliminate the bad gut bacteria. That microbiome plays a role in all sorts of health factors. Like I've said, the gut is connected to your brain. The gut is connected to all sorts of systems in the body, basically. And we need to nourish that, basically. So, yeah.
What do we mean when we say that we've got a good gut health?
So microbiome again.
Yes.
Feeding that microbiome. Making sure you don't have symptoms related to bad gut health. So that would be a lot of symptoms from top to bottom. For example, from the top, halitosis can be one of the things that patients present with. They come to me and say, "Doctor, look, there's a bad smell coming from inside." And I'm like, "Did you go to the dentist?" Gone to the dentist, gone to the ENT, no postnasal drip, nothing else going on. And you scope and you find something. Or you have reflux, for example, where acid is coming up from the stomach into the esophagus, causing symptoms like chest pain. The acid can go into the nose, go into all sorts of areas, even the lungs as well. Bad gut health. You can have bloating after a meal, feeling full, like early satiety basically. That can be a clue to bad gut health. Diarrhea, constipation, change in your bowel habit is an issue. Pain in your abdomen is an issue. Bleeding is a huge issue, to name a few.
At which point do we come see you?
So when we have alarm symptoms, and there are symptoms that we say need urgent review from a gastroenterologist. I mentioned bleeding now. So it can be bleeding from, for example, the anus, going to the toilet. There's blood in the toilet bowl. Or bleeding can actually not necessarily be bright red blood. Bleeding might just be dark stools. So that dark stool we call melena. Melena is digested red blood cells. And that's a danger sign. But not to forget, stuff like beetroot, stuff like iron supplements can actually change the color of your stool. So please, if you've had beetroot, don't come running to me and say that you have a red stool and I'm bleeding. Remember what you ate. So bleeding is a big one. Iron deficiency can manifest without actual bleeding that you see. And that's a problem, especially in men, because at least with women, we have menstruation. Right? You can investigate that and not discard the fact that it is just a gynae-related or period-related. You must exclude that. And then if that's still a problem, you come to, the gastroenterologist. Men, we investigate thoroughly. Like I said, change in bowel habit, sudden change, persistent change in bowel habit is a big thing that you need to review. Make sure that there's no malignancy. That's what you think, especially in an older patient. And pain that's persistent, like I said. Vomiting is a big one too, if it's persistent too. Yeah.
Let's quickly speak about the vomiting bit, because we hear a lot of people speak about cleansing their bodies, right, in some way or another. Whether you're taking a laxative, but I've also heard a lot of people saying that they are cleansing their system and they are forcefully vomiting. They're forcing themselves to throw up.
Yeah.
Is that normal?
It's not normal. So vomiting is a mechanism for your body to get rid of toxins. That's why we vomit. So if you are vomiting, there is something wrong. It's not something that happens naturally in the body. So forcing yourself to vomit makes acid go the wrong way. Acid that can damage your esophagus. And like I said, acid can go to the wrong pipe as well. It can go into your lungs. It can go to your sinuses, etc. It's not a good thing to vomit. So we do not want to induce vomit. It's not something I'd promote. Not
Laxatives?
At all. Laxatives, depending. So we use laxatives as medical professionals.
Yes.
I mean, to treat constipation, right? But if you're not constipated, taking a laxative is not indicated. The indication for a laxative is if you are constipated, So cleansing and, doing a purge, basically trying to detox. Your body detoxes itself generally. So I wouldn't go and do that without actually, consulting a medical professional or, I know our grannies love using these enemas, etc. And I don't want to diss the grannies, but we don't really want to do that, on a day-to-day basis. Yeah.
How does gut health affect one's immune system, our mental health, even our energy levels?
So the gut is the brain, has a brain, and the vagus nerve connects to the brain. It's the gut-brain axis. And there's so many studies taking place related to the gut-brain axis, libraries of studies. And for example, Alzheimer's is being related to gut health and microbiome at the moment.
Okay.
We have the neurological connections as well as the hormonal connections to the rest of the body. So the theory is the microbiome affects your mood. The microbiome affects autoimmune disease. It affects all other aspects of your body through all these neurological and hormonal connections. So
Sure. What are some of the most common digestive disorders that you've treated or that you continue to treat?
Sure, the list is quite large. Seeing as the liver and the pancreas are involved too. But the most common things that people come for, reflux, that's a huge one. Patients have the iron deficiency that I mentioned, and then we investigate those patients with scopes. Patients come in with diarrhea, and that can be related to inflammatory bowel disease, which is my passion. So inflammatory bowel disease being ulcerative colitis or Crohn's disease, and that's quite so it's a disease that basically causes inflammation in the colon and the small bowel, chronic ongoing disease. There's patients that come with IBS, and IBS means irritable bowel syndrome, which is different from inflammatory bowel disease, where you don't have abnormal bloods, you don't have abnormal scopes, you don't have abnormal stools, but it's a disease and it causes diarrhea. It can cause constipation or a mixture of both, and severe pain and debilitating pain for patients. So that's one of the things as well. Lots and lots of diseases, like the list can go on, especially if I start saying liver diseases. And in our society, we have fatty liver disease that is quite prevalent, and people walk around without knowing they have fatty liver disease because it's asymptomatic in the beginning. So, yeah, related to lifestyle diseases, basically. It's a metabolic disease related to your high blood pressure, your sugar, etc., and being overweight and having increased abdominal fat, basically.
So that fatty liver disease, what are we looking out for? You say it's asymptomatic in the beginning, but clearly it will develop, right? Later on. What are some of the symptoms that people should look out for?
So, like I said, it's asymptomatic in the beginning, but I keep emphasizing lifestyle modification and making sure your lifestyle is a healthy lifestyle, which, I mean, as medics, we can be hypocrites to this sometimes. But, you know, like your now they've changed the name. So they call it metabolic associated steatotic liver disease. Steatotic meaning fat in the liver.
Okay.
So metabolic diseases are those that I've mentioned in terms of your lifestyle diseases. So controlling any comorbidities that you may have or risk factors, like especially in diabetic patients, especially in obese patients. Alcohol can give you fatty liver disease, but that's a different disease as well. So if you are a drinker, not drinking at all if you have fatty liver disease, actually, like completely. And so you look at that, right? And in terms of symptoms, like I said, you maybe don't have symptoms because it's a spectrum. But when you go down the spectrum, the end of the spectrum can actually be cancer. And those patients will obviously be symptomatic.
Sure.
A hepatocellular carcinoma is a risk factor. HCC, as we call it, you can be very, lose weight. You can have night sweats, etc. In between that, you can have, so for example, there's patients that come that have bloods taken every year, and they have a deranged liver function test. And now we say, okay, what's going on? We do a scan. It shows fat in the liver. It's a shiny liver. We control all those risk factors. Losing weight is a big one. Then after that, you can get symptoms that can involve pain. One of the things that people present with is what we call right upper quadrant pain, where they say it's just aching. I don't know why. And then we figure out, okay, no, it's the fat infiltrating the liver. After that, signs of chronic liver disease that aren't specific to fatty liver disease. So jaundice is a big one. You know, yellow eyes, but then you're really quite advanced if you get to the jaundice phase. You can have vomiting of blood, where somebody has what we call varices. So that's increased pressure in systems that shouldn't have increased pressure because your liver starts getting hard. Your liver is supposed to be like a sponge. It absorbs all the blood around the body and expands. But as you get sicker and sicker with all the inflammation, you actually start getting scarring of the liver. That's when you get that jaundice phase. And when you get scarring of the liver doesn't expand like it should. It increases pressure in something called the portal vein and other areas in the body. And those veins can actually pop and you bleed. You vomit blood. So that's something we want to prevent. And that's why we want to figure these things out early. Lesions on the skin, early bruising, getting thin, like I said. You can get swelling. Even though I said you lose weight, you get swelling of the abdomen. Like, I'm sure you've seen somebody with a very big abdomen.
Yeah.
And it's fluid in the abdomen.
Sure.
Just to name a few of the symptoms. And like itching actually is one of the signs as well. Uncontrollable itching.
It sounds like there's also people who wait long, from what you've said, to actually get themselves checked out. How often then should we be seeing you?
So not necessarily me.
Yeah.
So I'm a subspecialist. It takes a a while to get to me.
Okay.
So usually I get patients that have already been diagnosed. Generally, that should be the way it works. But generally, your GP should be diagnosing these conditions. Because I generally treat the person that's been diagnosed. Not always, sometimes, or the more complicated cases. But I advocate for yearly checkups. I do my bloods every year. Just check. Yeah.
Just go. Get it checked.
Yeah, because you can find so many things just on blood tests.
Tell us what a gut-friendly diet would look like.
Okay. So it's debatable. Very much so. But generally, people or the literature advocates for a Mediterranean diet, which doesn't necessarily fit all our South African diets. So that's why I say it's tricky. Mediterranean diets, your olive oil, unsaturated, your unsaturated fats, sorry, got them mixed up. So your unsaturated fats, increasing your fiber, fruit and veg, which is not too bad if you think about a general diet in South Africa. But then they say fish and chicken, like your white meat, less red meat, basically. It's difficult, but I work with my dietitians. Always. Like, I need to work with my dietitians, especially if somebody has a disease. They need to tell me and guide, what a good diet would be. But in general, basically a Mediterranean diet.
Probiotics, yay or nay?
Another debatable topic.
Okay.
Another textbook topic. Yay, in some circumstances. We have a list of diseases where there are like proper scientific data studies that tell you probiotics are like properly beneficial, because these things are expensive. I mean, if you go to the store, it's not 200 Rand or less. It's more. It's on the upper side. So now telling somebody to take something that's really expensive without having good data, that's where I worry, Some people say when they take their probiotic, their IBS is better, the irritable bowel syndrome.
Okay.
If you can afford it, if it makes you feel better, I won't say no. It's not necessarily going to harm you. There's different types of probiotics as well, because remember, you're drinking a capsule with bacteria in it, and you'll have your different strains. So, for example, 9 strain will have different types of bacteria compared to maybe your 6 strain, etc. And there's higher strains as well. And then there's specific bacteria that you actually have better, benefits, basically, that have been actually studied and saying this actual bacteria needs to be in your probiotic, which aren't in all of the probiotics for your specific problem. So like I said, it's very debatable. When you swallow that capsule, your acid is in your stomach. Is it going to dissolve the probiotic? Will it get to your gut? Yeah. So you need to look at the brand. Is the probiotic like packaged in a proper capsule and all of those things? And then now you're buying something for maybe 400 Rand and it's not the one that,
you're supposed to buy.
Exactly. And what's the indication for it as well? But a lot of people with irritable bowel syndrome do take them. I know gynae patients, there is benefit as well, and as a woman in general. So if you can afford it, if you feel better taking them, take them. They're not going to harm you. But maybe consult a doctor and see if it's the right one for you.
What foods then are most beneficial for a good digestive system?
So fiber. Fiber is a big one. You get your soluble and insoluble fibers. A soluble fiber is a fiber that actually isn't too harsh on the gut, a soluble fiber. And we give a supplement called psyllium husk that actually acts as a soluble fiber and absorbs water from the gut and facilitates the formation of the stool into like a nice, guys, I'm a poop doctor, a decent, consistency, etc. Look at your stool, by the way, because it tells you a lot about your gut health as well. And look, fiber in terms of your bran and your harsher fibers, maybe your vegetables, etc. Also very beneficial. Then we talk about fermented foods. In the textbooks, they talk about kimchi, etc. If that's available. Yogurt is good as well. And fruits, vegetables, Mediterranean diet. That's basically. Yeah.
You said just now, look at your poop. How important is that? And why are people still so shy to look at their poop?
Please look at your poop. Do not come to my rooms without looking at your poop. It's so important. It tells you so much about your gut health. Like, it's so important. So we use something called the Bristol stool chart. I have the chart on my wall, but it's a cartoon. I have to always like turn it around and say, don't worry, it's a cartoon. And it goes from 1 to 7, and it tells you the consistency, the shape of your poop that's healthy or not healthy. And I ask the patients, look, read the description and tell me what your poop looks like. People must look at their poop, see the color, see if there's that red stool that we talked about, that black stool that we talked about. Is it green? What's going on? Is it watery? Is it small? How did you feel when you pooped as well? Like, I need to know that information in order to treat a patient. So yeah, it's really important. It tells you what is happening in your gut.
Stress and sleep, do they have an effect on one's gut health?
Yeah, definitely. So just as the gut has a super highway to the brain, it comes the other way from the brain to the gut. So I talked about irritable bowel syndrome. One of the precipitants for irritable bowel syndrome, stress. If you're not sleeping enough, you're going to have a problem with your gut. It's a two-way highway. It's not just a one-way highway as well. So, yeah, definitely. So those need to be managed.
Yeah. The issue, of course, I'm taking it back now to the issue of detoxing and cleansing. Do we all have to detox? Does everybody have to detox or cleanse?
No, your body's going to do it itself. Please don't, because some of you are hurting yourselves. And it changes the microbiome as well. And like, you don't know if you're benefiting your microbiome or making it worse. So, no.
Have you seen patients, Dr. Makumbi, where, they come to you and they're like, oh, I took a bit too much laxative?
Yes.
Oh, my.
Definitely. And that's when I was still doing internal medicine, which is the physician work. Lots of those patients get admitted to ICU, dehydrated, unwell, especially if, like, you don't know what you're taking sometimes. And something might be on the shelf in the pharmacy even, and it could not be something that's going to, do well in your gut. So.
Food intolerance tests, how often should we be taking those, and are they actually accurate?
So in terms of food intolerance tests, it depends on what food. So we have gluten intolerance, right? There's a disease called celiac disease, right? Which is a disease entity on its own, where you have antibodies to gluten. That's different from your intolerances, just to emphasize that. An intolerance, a food that makes you sick or makes you nauseous, makes you have diarrhea, etc., makes you have abdominal pain. We don't necessarily test it. It can be expensive, but there are tests available. Celiac we have to test. That's a different entity. But an intolerance, for example, lactose intolerance as well. There are tests, hydrogen breath tests, etc. Costly tests. See if you keep a food diary, for example. I have milk, and then my stomach runs. I mean, you can correlate kind of thing. Together with a health professional, just to guide you. But keeping a food diary and writing down how you feel with each food item is actually good enough to figure out what's going on.
That could be quite tedious, though. So at which point do I start it?
So if you do it for about a week and then, initially see me, for example, come do a food diary, come back and we look at the food diary together with a dietitian and we figure it out. It's not too tedious.
What are some of the myths, do you think, or some of the biggest gut health myths that are on social media that people are just believing?
So a lot of the stuff we've said about cleansing, a lot of, the big one is those hydro cleansing procedures that you don't need to detox. Your body will detox itself. In terms of different probiotics, not everyone needs probiotics. A funny one I saw is, if you swallow gum, it's going to get stuck in your gut forever. That's not one. That's not going to happen. And I can't think of any more offhand. Maybe it'll come to me.
What happens when you swallow gum?
It usually
gonna
gets
pass
out.
Okay.
Yeah. As a kid, we were told, don't swallow gum. It's going to get stuck in you. Things can get stuck. Please don't swallow gum, but not necessarily. Generally, you digest.
Okay.
Yeah.
What are some of the latest developments, in research that is currently taking place when it comes to digestive health and the gut health?
So the studies around the gut health axis. I'm actually doing a talk on this with a psychiatrist. I was phoned by a psychiatrist and asked to do a talk. And I was just like, why are you calling me? So that's the big area now in terms of studies. Other things, there's always studies in all spheres. Thing with gastroenterology, it's like so wide. That's why I also like it, because there's so many different facets to it. Upper GI, lower GI. Liver is the big one, like the fatty liver disease. There's new drugs being developed. And with the GLPs, that's a big one. Even in gastroenterology, not to advertise them, you need them if you need them, but related to obesity medicine and gastroenterology with fatty liver disease. They're saying with the GLP drugs that are coming out, the injectables, there's a lot of studies saying that actually helps fatty liver disease as well, because the principle is losing weight, right?
Yes.
So the metabolic benefits.
You know, there are people as well that are taking things like Ozempic to lose the weight and other things to lose the weight. Those things, what do they really do to one's gut health?
So what they do is it's hormonal, basically, and they decrease the food noise that somebody may have related to eating. And look, there are side effects on their own, especially with the one you just mentioned now. But they're newer, they're called GLP drugs that actually, they decrease the side effects of, they've decreased the side effects with the newer drugs, basically. That's what I'm trying to say. And those can be beneficial metabolically, decreasing food noise, decreasing the chances of getting high blood pressure or diabetes, because it is a diabetic medication, by the way. That's what initially it was developed for. It's the diabetic medication, but can decrease the chances of those metabolic diseases and the complications of metabolic diseases as well, like the fatty liver disease, like having a stroke, like having a heart attack later. So, yeah.
We spoke about stress and the relation that it would have to one's gut health. If I'm feeling unwell, if my gut is feeling some kind of way, besides coming to you, can I do things like meditation? Would that actually help?
Yeah. So, look, like I said, it's a highway. It's a bi-directional highway.
Yeah.
You need, if you have, for example, I diagnose Crohn's disease in a patient, right? And I do a scope and I say, actually, this patient's in remission, but the patient's still having symptoms. You can still have your gut affecting your colon, for example. Your gut and your colon, your gut and your brain are so linked that if you're having anxiety, if you're having stress, if you aren't looking after your brain, and I tell my patients this, you're not going to get better in terms of your gut. It's so interlinked that me and the psychiatrist phone each other all the time as well. My dietitian, psychiatrist as well. Shout out to the psychiatrist too, or psychologist. It's so important to keep and also have an outlet as well. A lot of us work, home, duties, have an outlet, manage stress. I always ask the patients, how do you manage your stress? What's your outlet? So yes, you need to manage those things.
So things like exercise.
Yes, exercise, big one. Go to the gym, do your 10,000 steps a day, Go have fun, even just, go paint, go have a hobby, do something, go touch grass, please, or your cat's not going to be okay, Yeah.
So what are some of the things that you would advise that we can do now, or things that we can take to improve our digestive health?
So try and look at your diet properly, Try and see that you're not having too many saturated fat. Try and balance your lifestyle. Try and decrease the alcohol intake. Don't smoke. And vaping, please. People come to me and tell me, oh, I'm not judging. I'm not judgmental. I'm just giving you advice. They tell me, I don't smoke, but I vape. I'm like, it's the same thing. We don't know what that does to your gut, okay? So let's decrease all of those things, and just be a holistic person in terms of looking after your general health, and the gut will follow. Yeah.
What have been some of the research or some of the reactions to things like vaping and smoking for one's gut health?
In terms of smoking, generally in your whole body, it's a risk factor for having cardiac disease, all the metabolic diseases that I mentioned, as well as a risk for, in my field, Crohn's, right? It makes Crohn's worse. Sorry, inflammatory bowel disease.
Okay.
So it makes my patients worse, as well as a risk factor for colon cancer, gastric cancer, esophageal cancer. So, no, it's not great. No.
Let's touch a little bit then as well on those cancers that you've just mentioned. What are some of the cancers that one can get from their gut? And how do we notice some of the symptoms?
So esophageal, your food pipe, difficulty swallowing is a red flag that I didn't mention as well. So when a patient comes, and we call it dysphagia, I can't swallow and I feel it here. I usually do a gastroscopy to see what's going on. That's one of the quick indications for endoscopy. Your stomach, you can have early satiety, which means fullness after a meal, or pain, right? And then the bleeding symptoms that we spoke about. Colon, the bleeding again, abdominal pain, just a feeling of having a change in your stool that's persistent as well. Those are the main things for colon cancer. The list is endless, really. And then remember, I do liver, like I've mentioned now, your liver, the pain in your liver, previous chronic liver disease, but pancreas too, which we haven't really spoken about. But the pancreas is a difficult one because usually patients present late because there's not that many symptoms. But later on, they lose weight. Some of them can get new diabetes as well because it's related to the function of the pancreas. Yeah. So if an older patient comes with new diabetes, I worry and look and make sure I image that.
I mean, I love tea. Love tea. Should we be having coffee or tea for our gut health?
Yes.
Which one is better?
So funny enough, coffee, right?
What?
Yeah, coffee is good. Coffee, there's studies showing that coffee decreases the amount of fat in your liver, but it's not your cappuccinos. It's like your plain
normal
black
coffee.
no sugar, no cream. And
Okay.
they say 2 to 3 cups a day of like proper coffee is actually good for your liver.
And the heart? I mean, those heart palpitations are not nice, eh?
We're talking about the liver. That's the more important organ here, please.
But let's talk then about the high fiber foods. We've got, the obvious of the oats and so forth. But what else should we be looking into just to ensure that we go to the toilet frequently?
So your green vegetables, your fruit and veg, basically. Yeah. Those are the most important ones. And they want fruit that has skin on. This is another important thing as well. Drinking your fruit and making smoothies isn't the best thing to do. We want you to chew your food, unfortunately. And that's another myth, actually.
Yeah.
Yeah. So people are making smoothies, drinking, and like putting very sugary food in as well, because fruit has a lot of sugar as well. Now you're putting it into a blender and drinking it. That's not a fiber, like proper. I sound so judgmental. I'm really not.
No, it's also because I looked at you a certain way and I'm like, man, I don't like chewing this fruit.
No, we must chew our food. Yeah. And yeah, just as sorry, I'm segueing a little
go
bit,
ahead,
but
yeah.
just on the topic, fruit juice, right? And our diabetic patients know you can't be drinking like a whole lot of fruit juice and thinking that's healthy. There's so much fructose and sugar in the fruit juice that also is a risk factor for fatty liver disease as well. So just be careful with the fruit juices. Going back to your question, fruit and veg, basically. And like you said, your bran, your oats, and basically, yeah.
Let's get to know you a bit better. What do you do to relax?
What do I do to relax? That's a good question. I'm a hypocrite. So, and I'm working on this. Like, literally, my partner is like, you need an outlet. And this is what I'm telling patients. I started doing my 10,000 steps. Right?
Awesome.
Finally. And I really haven't started, but I've been wanting to get into photography.
Oh.
Like, I feel like I'm a bit of a creative at heart. I want to explore that a little bit more, get into photography. I enjoy reading a good book. Mind you, I haven't read a book in a while. That's not a textbook. But I really need to take my own advice, to be honest. Chill with friends, love my friends. And my family, love my family. Like, I'm a person that likes to be surrounded by people generally. Though I'm so busy, to be honest. Like, I really need to work on that in my life, to be honest. And my friends will be like, oh, I haven't seen you in a while. Like, where are you? Kind of thing. But yeah, that's my aim, like to just be better in the second half of the year, being there,
Do a bit more for yourself.
And myself.
This time, absolutely.
Yeah.
What's your favorite snack?
My favorite snack? I'm a lady that's on a diet now, but I like popcorn. I love popcorn. Yeah.
And your favorite meal?
Sushi.
Okay. Do you get full, guys, on sushi?
Yes.
Okay.
And it's so many pieces, but yeah, I'm on a diet at the moment. Are you telling me about food? But I love sushi. Yeah.
What is the one place that you'd like to go to? You'd like to travel?
I went to a conference in Taiwan like 2-3 years ago. And the problem with going on a conference is you don't see the place properly. Yeah. So I went for a week we were inside, met great people, and they took us out like for dinner and stuff after. But I didn't actually get to see the country. And I really enjoy like Asian countries. So I want to do a trip to Hong Kong, Japan, and maybe go back to Taiwan. Yeah.
Okay.
Yeah.
What's the one place you've been to that you want to go back to besides Taiwan now?
Besides Taiwan, I liked Spain.
Okay.
Yeah.
Okay.
Spain. It's fun. I'm a little bit of a laid back person as well. And I also like history. So I like places with a lot of like, not necessarily museums like back to back and churches back to back, but I like historical places where I can go on a tour and see stuff, you know? Yeah.
For you, coffee or tea?
Coffee.
Of course.
Yeah.
Being a gastroenterologist, you would say coffee, of course. And what's the one word that you think your friends would use to describe you or family?
Somebody told me I'm effervescent. And I was like, So I liked that word.
That is a very nice word.
Yeah. So,
What do you do to de-stress when you've got a really hectic day? You get home, what's the first thing that you do?
I just lie on my bed. And actually, I'm a bit of a series junkie. And that de-stresses me. And I often get told the shows you watch don't match your intellect. But I'm like, I love trash TV. Like, that's my guilty pleasure. Like, any of those trash TV shows that you could mention, Love Island vibes, that's me. Like, it helps de-stress because my job is stressful.
Yes.
So why would I watch something serious? You know what I mean?
Absolutely. Do you foresee doing this forever and ever?
Yes, I love
Being
my
a
job.
gastroenterologist?
Yes, I love my job.
Okay.
Yeah.
And if you could leave our viewers with one message, what would it be?
So be kind to yourself. I know, like I've said, I sound like I'm being judgmental, you know? Everything's about balance in life, basically. Look after yourself, but also remember to have some fun too. That's, you know. So when I started gastroenterology and I started being a doctor, my aim was to be kind and be the kind of doctor that listens and guides, basically. I joke about being, like, you know, tough, but let's, you know, we work together and look after yourself, basically.
Absolutely.
Yeah.
Thank you.
Thank you very much.
Thank you for your time. Dr. Barbara Makumbi, gastroenterologist, joining us today on Conversations with Eminent Women, speaking all things gut health, but also just trying to get to know her a little bit better and what she does to relax. I hope you've enjoyed this conversation. Remember to like, to share, and to subscribe to our YouTube channel. From myself, Tsehohajo Moagi, and the whole team, wherever you go, whoever you encounter, just be kind and protect your peace. Bye-bye.